But when LaShawn Davis started to get sick, the terrifying symptoms were obvious to everyone. In 2000, 31-year-old LaShawn Davis was living outside Washington, D.C., working for the federal government. She was healthy, driven, and always very outgoing.
I was basically a workaholic. I did a lot of running around. I used to work out 3 days a week.
She's a go-getter. She's outgoing, very active.
And in the summer of that year, LaShawn and her family are thrilled to discover that she's pregnant with her first child.
I was feeling pretty good the first 2 trimesters. The last one started to be a struggle.
Like many pregnant women, LaShawn begins to feel extremely fatigued.
It was just difficult to walk, to get from point A to point B. I was always out of breath.
She slows down a bit, and then she catches a cold. Not much to worry about, she figures, but then suddenly, one day, she loses her voice. And 3 weeks later, it hasn't returned.
I went to the doctor, but unfortunately, they weren't able to treat it very well because of the pregnancy. They gave me different things to use, like cough drops and different sprays and stuff like that, but it didn't actually help.
Over the next few weeks, as her cold refuses to go away, LaShawn does her best to cope with her growing fatigue. She takes what over-the-counter medication she can and tries to stay upbeat. But then, in the 6th month of her pregnancy, a new and bizarre symptom develops.
One morning I woke up and I was just soaking wet. I just completely sweat the top and bottom of the sheets.
We just assumed that if she was sweating, she had a cold.
When I went to bed, I felt normal temperature, but in waking up, I was completely saturated. I would have these sweats at least every other night. I didn't feel like it was normal, but I really didn't know.
LaShawn checks in with her doctor about her symptoms, but he assures her that they're likely all related to the pregnancy. It seems to make sense to LaShawn, but then one change she was expecting while she's pregnant doesn't happen.
During the pregnancy, she didn't gain a lot of weight. We were worried about that.
I was extremely surprised that I didn't gain any weight. I had lost several pounds the year before, so I had anticipated during the pregnancy that I would gain at least 20 pounds, but I didn't.
LaShawn checks in with her doctor again, but is assured that the baby is developing normally and that not all pregnant women gain a lot of weight.
Everything was fine. They weren't really concerned with it.
The weeks go by, and LaShawn turns her focus as best she can on preparations for the new addition to the family. Then, 3 days before her due date, LaShawn begins to feel contractions. Her parents immediately kick into high gear.
And my mother just told her to get dressed. They were taking her to the hospital. She's probably going into labor.
They head to the emergency room. But the family is completely unprepared for what they hear next. After a quick examination, doctors inform LaShawn that her baby is in distress. She's dehydrated and needs oxygen fast.
It was very serious. She was supposed to have natural childbirth, and the doctor was on the way, but once they hooked her up to the monitors and they were losing the baby's heartbeat, and my sister's breathing was off, and I guess her oxygen level was dropping. And they had to do emergency C-section because they were going to lose both of them.
LaShawn gives birth to a healthy baby girl named Sydney. Mother and baby seem to be doing fine, but then a few days later, just as LaShawn is getting ready to be discharged, something scary happens.
Her temperature would go up very high, then it would go down, and then maybe it'll stay down for an hour or two, and then it'll spike back up.
High fevers in women who have just given birth can indicate a potentially dangerous infection.
They immediately tell me that I can't leave. The baby was given a clean bill of health, but I wasn't.
What was supposed to be a routine delivery turns into a nightmare. Over the next week, doctors discover that many of the symptoms LaShawn had while pregnant, fever, sweats, and fatigue, have returned, and they don't know why.
They're just constantly running tests, so they were actually looking for something definitive.
While the tests come back inconclusive, doctors discover that LaShawne's white blood cell count is high, indicating inflammation or infection somewhere. For the next few days, LaShawne's fevers continue to spike 102 and 103 degrees, and her oxygen levels remain low. X-rays of LaShawne's lungs show scarring, which could mean any number of problems. So the doctors decide to perform a biopsy of her lung to see what they can find.
I really was concerned about what was going on.
The procedure goes smoothly, but just as she is being wheeled out of the operating room, her vital signs go haywire, and she's rushed into intensive care.
Most of the time when you're in intensive care, you don't know if it's life or death.
Just days after giving birth to a healthy baby girl, LaShawne Davis finds herself in the ICU, suffering from high fevers, sweats, low oxygen levels, and a high white blood cell count, indicating a possible infection or some sort of inflammation.
They were running tests, and nobody could give an answer to what was wrong with her.
It was extreme. I really wanted to know, what did I have?
But despite the medical team's best efforts, they can't figure out what's making LaShawne so sick. Eventually, they begin administering doses of prednisone, a steroid designed to reduce symptoms associated with inflammation. She stays in the hospital for another 2 weeks, and during that time, she does seem to respond to the treatment. Finally, 1 month after delivering her baby, LaShawne is allowed to go home.
I'm very frustrated that I've ran all these tests, that I've been in the hospital all this time, and they're not able to determine anything.
As instructed, LaShawne continues taking the prednisone, but the drug is known to cause severe side effects, such as swelling of the face, weight gain, and irritability. So after a few more weeks, the doctor begins to decrease her dosage. But as soon as she tapers off the medication, her symptoms return with a vengeance.
I'm having the fevers and the sweats. I'm having a lot of swelling in the ankles. Physically, I'm feeling really weak. I'm not able to lift the baby. I'm moving slower than I've ever moved before.
Finally, the results from LaShawne's lung biopsy come back with a partial diagnosis. They show she has interstitial lung disease, a nonspecific lung disorder which can cause scarring of the lungs and difficulty breathing. But it's still unclear what's triggering the condition. She's immediately referred to a pulmonologist for follow-up.
I start seeing a pulmonary doctor once every 2 weeks. They're doing pulmonary function tests to determine how much oxygen I'm actually getting in and how much I can actually push out. My ability to do that is gradually decreasing.
But the doctor can't figure out why. As the testing continues, LaShawne's maternity leave runs out, and the exhausted new mother is forced to return to work.
It felt draining just to get from point A to point B. I was a walker. I was used to walking very swiftly, and now I was completely wiped out just getting to work. I could not get from the elevator down the hall to my office without stopping a couple times.
Then, one day, as she's leaving the office, LaShawne's profound sense of fatigue takes a terrifying turn for the worse.
I get back to my car, and I go to crank the car, and I can't get enough strength to crank it. I wait a few minutes, and I try it again. But each time that I try to do it, my wrist is getting weaker and weaker. And so I wait a few more minutes, and I still can't crank it. I'm completely frustrated. I'm crying. I don't understand why I can't crank this car. I knew something was really wrong then.
Finally, drawing on every ounce of strength she can muster, LaShawne manages to start the car.
I'm completely frustrated. I'm crying. I don't understand why I can't crank this car. I knew something was really wrong then.
Finally, drawing on every ounce of strength she can muster, LaShawne manages to start the car.
My thoughts were that I needed to call the doctor. I needed to find out if there was any other test that we could run. What else could we do?
When LaShawn checks in with her doctor, she tells him that the pain and weakness seem to be in her wrist. So the pulmonologist refers her to a rheumatologist, a doctor who deals with joint problems. The rheumatologist orders an electromyogram, a procedure that measures muscle function by stimulating muscles with electrified needles. A positive reading will indicate muscle or nerve damage.
Those particular tests did come back fine, and so unfortunately they're sort of at wit's end trying to figure out exactly what it is. There was nothing that I could do.
And as the weeks go by, the weakness she's experiencing continues to get worse.
Because of the weakness in my hands and my wrist, I'm not able to do things that we take for granted, that are everyday things, like open a soda bottle, open a jar. I'd have to wait for someone else to come home to actually open stuff for me.
LaShawn is forced to rely on her family for help with just about everything.
It was very difficult to do long walks, shopping, going to the grocery store. I usually had someone do it for me. I definitely needed assistance in putting on my socks and tying my shoes. All of the ordinary things that people wouldn't think that you would need help with, I needed help with.
It's hard to see someone that you know was always active, and then you can't do any of that. We did everything we possibly could to help her.
She had a lot of family support. When a family member has a sickness, we just rally together around that person.
As the weeks drag on, it gradually becomes more and more difficult for LaShawn to move at all.
Sometimes I just could not get up. I just could not do it.
LaShawn Davis has spent months coping with shortness of breath, swollen hands and wrists, and extreme weakness. She has undergone numerous tests to try to determine why she has a high white blood cell count and what is causing her to feel so awful. But all the results come back inconclusive.
I took her to the doctor more times than I got fingers and toes.
After about 6 months of running various tests and coming up with different lab work, I was concerned that my condition was worsening.
Determined to find out what is going on once and for all, LaShawn changes her insurance and schedules an appointment with a new pulmonologist for a second opinion.
He knew that I was having difficulties breathing, but he also knew that I had extreme swelling in my hands, my wrists, and the different symptoms as far as not being able to open stuff and the bending down or the getting up.
The doctor decides to put her back on the steroid prednisone to see if that will help with her inflammatory symptoms. He also refers her to his colleague, Dr. Lisa Christopher Stein, a rheumatologist.
I had been looking at LaShawn's chart and reviewing the data that was available to me. She seemed like one of the sickest patients, that's certainly on paper, that I had seen in a while.
I think my numbers were just something that she had never seen before.
She had an extremely elevated white blood cell count that I could not justify. It was about 4 times the usual level. On average, we say about 5 to 10,000 is the count. Hers were as high at times as 30,000.
Dr. Christopher Stein knows a high white blood cell count can be an indication of a variety of serious conditions, including infections and cancer. So she orders a biopsy of LaShawn's lymph nodes to see what she can find out.
The first time I heard that it could be cancer, I was concerned because I had an infant. I was worried that I was not going to be around to see my daughter get older.
A few days later, the biopsy comes back negative for cancer, and LaShawn is relieved that the doctors can rule that out. But further blood tests do show something interesting. She has elevated CPK, an enzyme found in the heart, brain, and muscles, which could be an indication of muscle damage and possibly inflammation.
When muscles are irritated or inflamed, they can leak the chemicals like enzymes into the bloodstream in higher levels than are normally found there. That was what happened in LaShawn's case. A normal CPK on average is somewhere between 100 and 200 or 250. LaShawn's numbers were around 1,500.
Dr. Christopher Stein is determined to find out why LaShawn's muscles are leaking this enzyme. She immediately orders an MRI of LaShawn's thigh muscle.
After the MRI showed that there was some inflammation in her muscles, we used that to guide us to biopsy those muscles. After looking at her muscle tissue under the microscope, it showed evidence that her muscles were indeed being attacked by her own immune system. The combination of interstitial lung disease, weakness with elevated muscle enzymes, and a positive muscle biopsy, in combination with the antibodies we saw, led us to the diagnosis of polymyositis.
Polymyositis is a rare autoimmune disease that occurs when white blood cells spontaneously invade muscle tissue, and in some cases, lung tissue. The affected tissue becomes inflamed and stops functioning properly. Its cause is not known, and about 50,000 people in the United States suffer from some form of myositis. About 30% of those people will have lung disease as well.
Polymyositis literally means many muscles inflamed. In LaShawn's case, not only does her immune system recognize her muscles as foreign, it recognizes her own lungs as foreign. Why this occurs is a mystery to all doctors.
I was relieved to know exactly what it was, because then it meant an opportunity to see how to at least deal with it.
There is currently no cure for the condition, but it can be managed. LaShawn is prescribed the drugs Imuran and methotrexate to suppress her overactive immune system. And because of her particular illness, it is likely she will need the medication for the rest of her life.
With the medicine, I'm able to get from point A to point B without it being as much of a hardship. I'm able to get up out of a seated position on my own. I don't have to worry about whether I can start the car or not.
LaShawn is forever grateful to Dr. Christopher Stein for finally identifying her condition. Unfortunately, the disease can be difficult to pinpoint.
The symptoms can be so nonspecific initially, and then patients themselves sometimes don't recognize that they're getting weaker, or they do and they blame it on a host of other things.
One thing's for sure, LaShawn is lucky she was diagnosed when she was.
This disease can be fatal because the lungs continue to be inflamed, scar further, impair your ability to get oxygen to the tissues, and without oxygen, we die.
No one knows for sure, but doctors suspect that the flu-like symptoms LaShawn experienced during her pregnancy, fatigue, weakness, sweats, a lingering cold, and laryngitis, may have been the first warning signs.
In LaShawn's case, I suspect that she was at risk for some perhaps genetic background that we are unable to know more about at this point in time. And then there was a second trigger, whether it was a virus, whether it was her pregnancy, whether it was anything in the environment, I cannot say for sure.
Oh, you've got all the short gauges, and I have all the long. Is that what's going on? OMG.
Today, 5 years after being diagnosed, LaShawn is still adjusting to a slower lifestyle.
My condition right now is I'm pretty stable. I have to try not to overexert myself.
We've talked about the possibility of a lung transplant, but to date she's been able to avoid that, and I'm hopeful that we can continue to treat the disease, suppress her symptoms, and hopefully avoid that in the future.
She tries to live as a normal life as possible. She does have oxygen at home, so when her levels do drop, she can get on the oxygen. Her daughter's getting older, so she's able to help her. To me, she's doing much better.
It's very difficult to see your child sick and you don't know what's wrong with them. But then, when they're better, you just have faith that God has came through.
I have good days and I have bad days, but I'm definitely more functional than I've ever been. This whole experience